the last presentation by Dr. Lisa Richardson. She's a strategic lead at the Center for Wise Practices in Indigenous Health at Women's College Hospital. Dr. Richardson.
Thank you so much, and thank you for accommodating me today. Madam Chair and Honorable Senators, I speak to you from the traditional territory of the Mississauga of the Credit, the Haudenosaunee, the Seneca, the Huron, and many other people from across Turtle Island, which is Toronto, is where I am currently located. Miigwech, I'm a mixed-blood Anishinaabe Kwe. My community is known as Shabahananang, colonially known as Killarney. I'm an internal medicine specialist. I'm an associate professor and vice chair in the Department of Medicine. I'm the strategic lead in Indigenous Health for Temerity Faculty of Medicine. I'm the co-chair of the Indigenous Health Committee of the Royal College of Physicians and Surgeons. And I'm also a new member of the executive committee of the newly founded National Consortium on Indigenous Medical Education. I am not a legal scholar. My scholarly focus is on Indigenous health, specifically on medical education and on the recruitment of Indigenous physicians into the workforce, but also a huge component is on the experiences of racism that Indigenous peoples experience in the healthcare system. It's in this capacity that I express my concerns about the expanding MAiD to include people whose natural death is not reasonably foreseeable. Why is this? This is because Indigenous peoples are not secure in our health system. Racism exists in healthcare. In fact, I spent last week 2 full days or half days listening to statements about the experiences of Indigenous people and the racism that they all had in the healthcare system. It was a meeting that was convened by the federal government, and we spoke to Ministers Hajdu, Ministers Bennett, and Ministers Miller. That meeting actually evolved because of the racism experienced by Joyce Echaquan. But what we know is that Joyce's experiences in healthcare are not unique. In fact, we have significant evidence that documents how our people receive a different level of care. For example, we have studies that show for people with Indigenous people with coronary artery disease who meet criteria for cardiac catheterization are not referred. We have studies that show Indigenous people are not referred for renal transplant. We have public inquiries like that of Brian Sinclair, the First Nations man in Winnipeg, who went into an emergency department to have his Foley catheter changed and died of urosepsis which is infection due to a urinary tract infection, because people assumed that he was a drunken Indian. There are so many stories of ongoing mistreatment of our people. And my concern with this extended bill is that we will not, until we eradicate this racism in our healthcare system, we will see an unprecedented and disproportionate number of our people who are affected by it. I also had the honor and responsibility over a year ago of presenting at the Standing Committee on Health about the forced and coerced sterilization of Indigenous women. This is just another example about the racism that exists in our healthcare system towards Indigenous people. What was demonstrated from that report of the Standing Committee, based on the class action lawsuit filed by Indigenous women who'd experienced forced and coerced sterilization, with the most recent case being in December of 2018, was that Indigenous women who entered the healthcare system actually did not make informed consent, because often they were either denied access to the information, they were coerced into sterilization, or in the worst case scenarios, they were not even told that this was being done. And although it's appalling to imagine that this occurs and that these are members of my profession and of other healthcare professions who are involved in this racist activity, it is well documented. So in an environment where both systemic and interpersonal racism exists, I don't trust that Indigenous people will be safe. I don't trust that Anti-Indigenous prejudice and bias will not affect the decision-making and counseling about MAiD for Indigenous people, no matter how much education is given. There are my second point is around the social determinants of health. We know that inequities related to the upstream determinant of colonization, like poverty, food insecurity, inadequate housing, and a higher burden of chronic disease, disproportionately affect Indigenous people. These social determinants can lead to enduring and intolerable suffering. But this suffering can be relieved if we address these social determinants. It must be a bill that does not actually take into account how social inequities affect disproportionately Indigenous peoples is highly problematic in my opinion. Lastly, I wanted to speak to the point around self-determination. I do know that you have consulted with my numerous Indigenous colleagues and heard from them as witnesses. I was not able to join them yesterday, but any legislation related to healthcare that involves Indigenous peoples must be done in partnership with us. This is in accordance with our Indigenous rights, as well as the UN Declaration on the Rights of Indigenous People. There is a need for more meaningful partnership and input from Indigenous peoples, First Nations, Inuit, Métis, of different backgrounds, different traditional territories. There is a huge diversity amongst us in terms of our belief systems and our approaches. And unless adequate consultation is done, I believe that this is, we are not upholding the right to respect the needs of Indigenous peoples. So those are my thoughts. I do not have any clear recommendations for you, except my cautionary words around the need to eradicate racism in our healthcare system, which will continue to play out if we expand this bill in the application of MAiD to our people.